All right, to discuss further, we're joined by the spokesperson for the Shonisani Lethole family, that's Ndinnanyi Siminya. Mr. Siminya, thank you for being with us. Nothing can bring Shonisani back, but is it heartening to the family that there has at least been some acknowledgement here that something went terribly wrong? I mean, it sounds like there were more than a dozen people involved and nobody even saw that there was no feeding tube.
Yes, the findings are horrific. And it's quite scary to expect that from a public hospital intended to handle such large numbers of cases, particularly in such a time. So yeah, it was frightening what we were given or found in the report.
And I think the whole country is horrified, and seemingly the family not alone. Do you expect more people to come forward?
Yes, we do. In fact, we urge more people to come through. So that we can rally on and really hopefully, or not even hopefully, work towards changing the hospital so that it is in the business of saving more lives than it is taking.
Let's look at two things. The CEO is not stepping down. That's something that the family wanted. And he says the report is one-sided. The hospital wants to challenge the report. What's the family response to that?
Look, we are obviously disappointed, but it'll be naive to say we're surprised, as this has been the character that he's portrayed throughout this whole process. And yet we also have to respect the fact that he has every right to challenge as a citizen. However, we still feel as if he's not taking accountability, and quite disappointed in his choice.
And on the other hand, the health department says it's not challenging the report. What does that mean? Could there be some compensation here for the family?
We can't really say, as that will be the health department's decision. However, and that will be based on the legal procedures that are already underway. However, they have assured us that they will take the recommendations from the report and have no objections towards them, actually.
Yeah, have they given you any further details of what that could mean? I mean, government could surely step in here and say management of the hospital is amiss. Government could do something about it.
Well, in some of the recommendations from the Ombudsman was that the disciplinary hearing should be held for the staff members. Mentioned 19 should go through some sort of intense disciplinary hearing, including the management and the account managers, the CEO. And the health department has assured us that they will follow through on those recommendations. How that is implemented and how long that may happen is really left to, I guess, them at the end of the day. But we will press on as best as we can from a campaign perspective under the Fix Tembisa Hospital Now campaign, and really try as much as possible to rally behind some of the people that have already started this fight to try and change that hospital already. Yeah. The government is the government, and there's only so much we can expect or even leave in their hands without also trying ourselves at this point.
Well, so like you said, this is becoming a whole campaign, a whole movement. Do you think with sort of a community approach here, lots can be done? What's in the pipeline? What's planned?
We've released a petition that has ironed out a few things that is currently available for signatures, and we intend to release that and bring that towards the presidency. The community rallying behind, there's all sorts of civil societies and religious leaders that have also rallied behind it and are trying very hard and even offered their hands in assisting the hospital to help the community. So the community of Tembisa and I guess the neighboring communities as well are showing mobility and wanting to make a change, as opposed to just waiting for some sort of change. However, it obviously would be a bonus if the government comes and helps as well, as they are in many ways a service to the community.
Finally, Mr. Siminya, I mean, this happened presumably because no family members could go into the hospital or near Shonisani because of COVID. We heard about nurses being threatening. Is there a much bigger problem here? Do you think because of COVID-19 there could be a lot happening with less accountability in hospitals across South Africa?
It's very hard to say. Reason being, I'd be almost, I believe, unfair to assume the stresses that happen within the hospitals, right? However, from the stories that we heard, some of them were before the COVID-19 pandemic. And it seems that in many occasions that seems to be the culture.
Yeah. So this is Tembisa Hospital specifically in your view.
Yes. So I can't really speak for other hospitals, and I don't want to speak unnecessarily without really having some sort of idea of what's happening outside. But I can safely say from Tembisa Hospital, it seems that this was the culture already, that in a pandemic it just amplified and made it worse, that there is no accountability. There's a sense of unethical behavior, rudeness by staff. So I don't have the numbers to say if this escalated or not, but what I can say is that from the stories that we did share, some from the press conference, that these were some happenings that happened before this whole pandemic, that truly it is a hospital problem more than anything. If this by some chance is a reflection of other hospitals, then it is a problem that somewhere along the line we are missing some sort of code of ethics, and I don't know if that already exists and if people are maybe not adhering to it as they should. But I would have to hear from what other provinces are.
No problem. Let's see what people say about their experiences. But right now, you are absolutely correct. The focus and even the previous stories, some during COVID, some not, are coming out about Tembisa Hospital specifically. Thank you very much for your time and that reasoned explanation. Spokesperson for the Shonisani Lethole for his family, Ndinnanyi Siminya.